What actually happens at therapy and counseling? I've gone to therapy and this is the gist of my experience. You won't get anything solved in the first 3 or 4 sessions. This is the time that your therapist takes to know you and find out what would be the best approach to solve your issues. These first sessions are filled with personal questions that you might feel uncomfortable answering, but it's really important that you do. After the initial sessions, most consist of you telling the therapist what has been going on in your life since the last session. If the therapist identifies negative behavior patterns, he'll let you know and how you can work on that. Another common thing is to arrive to a session after an event that made you sad, angry, happy, whatever since last session, and discussing it to understand why it made you feel that way or how you can stop feeling like that. And #X2OOB. And that's pretty much it. Therapy is one of the best things you can do for yourself if you feel like you're not doing okay, but you must be ready to ask for help and be willing to work on yourself. Otherwise, therapy is useless. It does feel like you're getting nowhere in the start. The couch isn't really common, at least to my knowledge. You'll most likely just be sat down. They will then talk about essentially anything. Everything from what you do in your free time. But, obviously, primarily what you're struggling with ATM. Whether that be economically, romantically, emotionally, etc. A good reason therapists sometimes look useless is because they primarily listen. Take notes for next time. And only ask questions once in a while. A therapist is a listener. It feels nice to open up. And thus a therapist is great, since it's someone that otherwise has no influence on your life. Most likely don't know anyone you do, and may have complete confidentiality. They aren't at all allowed to talk to anyone about anything. This even goes for names. It's a nice way to open up without actually being public. It's like talking to a mirror. Except the mirror asks questions to help you reflect. Pun intended. A therapist's job is to make you feel like you're improving. It's to make you feel like you're getting better. A therapist will often ask simple things, and won't get mad if you talk for too long. That part is nice, haha. A therapist will allow you to discover and solve what might be bugging you. They help you, if you will. The couch is a movie prop. I know a lot of counselors and psychologists, and none of them encourage people to lie down when they talk. It creates an imbalance of power. I'll give you an example of what might happen. A young man comes in trying to sort out some past emotional trauma. He is currently in a polygamous relationship because he is not possessive or jealous and wants to figure out why he is feeling insecure about the love of his main partner. The counselor talks him throughout his past relationships and security issues, and asks him to express what emotions he is feeling about his current situation. Through the words he uses, he realizes that what he is experiencing is jealousy. That is not how he views himself. So he needs to figure out what he actually wants and needs versus what he thought he was okay with, and then how to move forward from there. A good counselor will not tell you what you need to do. They will ask the right questions to lead you on a journey to understand what issues are hindering you. How long people go is very much on a case-by-case basis. I have been to 7 therapists. 1 great and the rest were meh. The great one was distinguished by the following. Had me identify achievable goals in the first session. Didn't spend 3 weeks on family or personal history, but rather asked those questions organically as they came up. Asked direct questions and didn't interrupt the answer. Didn't order me to do something break up with him, quote, but rather guided me towards an endpoint of goal achievement and bettering my life. Assigned homework, tasks that I was to accomplish between sessions. Recommend literature, fiction and non-fiction, films, and TV shows that featured characters I could connect with and discuss in future sessions. Taught me functional, sustainable tools to handle stress, anxiety and depressive episodes. It's important to recognize that not everyone who enters a field of business is going to be good at the profession. Likewise, your therapy is unique to you and should not be approached as if your issues have a universal solution. I should note that I have a pretty common mental health issue, MDD, or the old crippling depression, and I have no idea if the approach used on me would be successful for those with more unique obstacles. I've seen 2 therapists in my life. Both did have a long couch, but I always used a normal seat, chair. At the first therapist, I don't know if anyone's ever lays on it. At the second, I was told that laying down was part of a different type of therapy, so not the one I was getting. Not sure what that means. Both were pretty normal-looking offices, with a bookcase, and 2 seats, and a box of Kleenex like another poster said. We'd sit opposite each other and I would start talking about what was on my mind. All subjects were okay to talk about. Sometimes we'd talk about my dreams and what they could mean. As in, what relation I could see in that dream and what was going on in my life at that time. The best thing is that I have little to no fear about speaking about things with this therapist. I've never been this honest with anyone. Not even to my friends or family. I see a therapist as a second pair of eyes in my life. I tell them my experiences, and they offer a different perspective when needed. I've learned that I get stuck in thought patterns that are unhelpful and sometimes even incorrect. None of this was easy though. I was a bit of a bitch at first, being in pain and being scared. So don't expect huge revelations or to be cured within a month. It's helped me with my self-esteem, helped me balance out the many fears I have, and slowly helped me try more new things. This took a long time. It wasn't fun at the beginning and is rarely fun now. But is it super helpful? Even if talking and digging up old memories hurt, you'll always get out a better. Edit. A PS when my time is up. 45 minutes. Both therapists would say, "It's time," in my language. A better translation might be, "It's 4," or whatever time your normal session would end. It's a gentle way of saying we need to stop for this week. I, 19, was in therapy most of my life. The most important thing I can tell you is to keep looking until you find a therapist that feels right for you. I've had one that was right for me and one that wasn't. And the difference was genuinely life-changing. Now to answer your questions. It's ultimately the client's decision, but most people have hour-long sessions once a week. I can't actually remember the very first thing a therapist has said to me. But sessions usually started with something to the effect of, "Has anything in particular been bothering you this week?" Quote, regarding how much of the talking they do. A good therapist will judge what you need from them. If you have a lot to say, they'll sit back and listen. If you need a gentle push, they'll ask you some questions. Good luck, and I hope this was helpful. Honestly, therapy is mostly just the therapist trying to help you grasp and view your problems from different perspectives. It's definitely not like taking medicine where it just automatically solves your problem. But it's more of a catalyst for personal growth. They usually try and ask questions to help both them and you reveal what's bothering you. I think a common thought is that I already know what I feel and how I think. So what's the point of having someone else ask the same question? But honestly, it's quite a different experience when you say it out loud to someone else. Other times, you can just talk about daily stuff. Tiny things that you find annoying and they won't mind either. It's simply a safe space for self-expression. And yes, most of them have sofas and couches. But it's mostly just because it's comfy to sit on. Hard plastic chairs suck after all. In short, it basically helps you kind of grow mentally. I go once a week, for 50 minutes. Sometimes we also do Skype due to Corona. There's no couch and I'd feel really weird lying down, but my therapist's office has some really nice, comfy armchairs. The only issue is they're leather, and once I went there in a dress and all I could think of is the sweaty imprint I'll leave. Also, He doesn't have any notebook and he doesn't write anything down. At least when I'm there. Like they do in the movies. To be honest, every session is kinda different. We have sessions where I cry for 50 minutes. We have sessions where I'm super positive and satisfied. We talk about a lot of things. My childhood, family, how I perceive myself, etc. He very often asks me to name my emotions at the moment because I have issues with doing that. He challenges some things I say too, like how I approach my parents, how I think I have to function in a society, etc. Mostly it's just a really nice, safe space for processing and expressing your feelings. I am amazed people are really nice and helpful when someone asks a hard question. There is hope for humanity after all. When I was at university they had us watch this video. https://www.youtube.com/watch v=nft89 graoi to help us understand the different approaches to counseling and therapy techniques. It's long, 1 hour 45 minutes, and old, from 1965, but I think it's really good at demonstrating how varied approaches can be. In particular, I was quite shocked at how, for lack of a better term, aggressive Fritz Perls is. Therapists just help you think out loud and untangle your thoughts. It's amazing how hearing yourself out loud and getting a little outside feedback can change your mindset. It depends what you are going to therapy for. It really does differ from place to place, and depending on what you are going to therapy for. And it's very unlikely there will be a sofa to lie on. Though that might be nice. It would depend how forthcoming you are with info as to how much the therapist might ask questions. My therapist lets me speak as long as I need to. Then we carve out the issue and what kind of intervention might help. Can be a system dynamic approach, something creative, or just getting to a point of acceptance. Sometimes there's homework, most of the time not. Yes, there is a couch, but I could also choose to sit on the floor or a chair. Anyways, it is not staring up the ceiling talking into a void. You want and need face contact, so that therapist can assess your state and lead the season accordingly. One thing that is always there is a box of tissues. For good reasons. Emo. The most dramatic example for me has been solving trauma by EMDR. https://en.wikipedia.org/wiki/eye-movement desensitization ad reprocessing. This is a method where you relive a traumatic experience. So you go there willingly without trying to avoid it, but therapist helps you through the pain. You basically reprocess and reassess the experience so it no longer hurts. There are many different types of therapy. I went to a counselor who uses rapid result therapy, or something. I can't remember the exact term. And we got a lot of work done in just 4 sessions. First session, I filled out paperwork with some general questions on it and some more personal questions. We had a brief talk about why I was there and she guided the whole thing. She asked me questions. I answered. Then we moved on to a meditation and coping mechanisms. She explained the science behind what was happening in my brain as well, which helped tremendously. After those initial visits, every time I go now, it is a bit more in-depth to certain problems and she helps me find the root of insecurities, anxieties, what have you. Very important side note, if you don't like your first pick, don't stick with that therapist. You want to feel comfortable and you want to feel like the therapist has validity. If not, you aren't going to get anywhere. My therapist and I sit on the front lawn of his office under a willow tree in a socially distanced setting. Super relaxing. And we talk. We talk about a lot. I've been to probably like 7 or so therapists. Each one is different. I had several good therapists. And one therapist so awful. It made my depression worse and he got me kicked out of school. Of the therapists, maybe half have had a couch but it's not really to lay down on. I would just sit for the entire session. First sessions change for every therapist, but most will get at least a bit of background. Obviously name. Often they ask why you think you're there. One of my therapists asked background questions for like 3 weeks and I got sick of it, so I stopped seeing him. Some therapists, you just go over what happened in a week and how that made you feel. I used to have a lot of anger issues, and so my therapist would ask how my week was and I'd tell them why I got pissed at random minute details. How long someone needs to go depends person to person. Could be a year, could be 10, could be anything really. Sessions are usually 1 hour though. It depends on the therapist and how they operate. My best therapists will lead me to observations about myself. They might add in some unique terms or help clarify why I would react that way, but it's mostly a me journey with help. Currently, I'm in EMDR therapy, which is its own question because it's a very specialized type of therapy aimed at helping PTSD and trauma patients. One of my worst therapists worked like TBIS. You tell him you got mad that week and it was totally random. You don't even remember why? He would go into a story about how he used to treat a patient who worked in an office. Then he'd ask if you're doing your breathing exercises. You say kinda. He says they will really help, I promise. Then you leave. One of my best therapists worked like Thea. She would ask about what I want to talk about this week. What's been weighing on my mind? I'd tell her about something. We would go into deeper processing with EMDR, but questions were like what are feeling and what is your reactions, and let's process that emotion and see where it leads. Very different experiences, but therapy can be great. It's a very useful tool to help you understand yourself if you have a good therapist. Once you can understand yourself, it can help make you into the person you want to be. It's slow but worth it if you find a good one. Looks like it's been covered pretty well. I've been doing therapy about a year now. Anecdotally, I'm still fucked up as a 9-eyed spider gazing into a funhouse mirror. Sorry, that's the best description I have. It's close. Edit. Added a word. I've done therapy a few times, and honestly it's you and another person talking while on comfy furniture. There are often couches or armchairs. Usually nice decor and a discreetly placed box of Kleenex somewhere. Sometimes it's just built up in your mind more than anything. You can talk about lighter stuff like how you found your hobbies or spent your weekend until you feel comfortable opening up about any issues you want help with. It's guided by you and you have absolute control over stopping or pausing the session if you're uncomfortable. Depending on your healthcare system, the first visit is usually a patient intake where they will go over your mental health history and ask you questions such as, have you had thoughts of suicide, etc. This is just to get a better idea of who you are and what is troubling you. It's mostly you talking from there and them getting you to look at things a different way or help cope with thoughts, and also talk about how to develop better behaviors. If you're going to a therapist that is connected to your healthcare system and you have a psychiatrist, your visits will be more intensive. I once had to see a therapist 3 times a week for a while because of the severity of my situation. I have not seen a therapist outside my healthcare system, but from what I hear things go to slowly and visits are like once a week. My therapist lets me lay down, but that's BC. I got the cancer and some days were harder than others. I have fallen asleep on our couch before, but usually they want you comfortable in any way possible. I liked sitting on the floor and talking.